Welcome to Soria IV catheter training, a product developed by MedSource Labs and presented by Critical Healthcare. It is remarkable that approximately 1.7 billion IV catheters are utilized globally each year, highlighting the significant demand for these critical devices. In the US alone, around 345 million safety IV catheters are used annually, showcasing the importance of ensuring patient safety during vascular access procedures. Market leaders in this sector include prominent companies such as BD, B. Braun, Smiths, Terumo, Retractable Tech, and MedSource, each contributing innovative designs to enhance safety and reduce infection risks. Noteworthy are products like TrueSafe and BD, which are recognized as active devices that incorporate safety features aimed at protecting healthcare workers and patients alike, reinforcing the trend towards safety in medical technology. This sets the stage for our next focus on vascular access devices, which encompasses a variety of catheters, cannulas, and infusion ports. Vascular access devices are part of a larger critical network in healthcare. These devices, including catheters, cannulas, and infusion ports, ensure continuous or intermittent access to blood vessels, which is vital for delivering essential medications, fluids, and for drawing blood samples. Their integration is key for effective patient management. Next, we will delve into the technical data associated with these devices, examining their specifications and performance metrics. Understanding the technical data is essential as we delve into catheter design. The tapering and forming of the catheter tip are critical for ensuring a smooth venipuncture experience. A well-designed catheter tip minimizes trauma to the vessel, facilitates easier insertion, and enhances patient comfort. The tri-tip needle technology utilizes advanced engineering to create a design that reduces the required force for insertion. This innovation leads to fewer complications and improved procedural efficiency. As healthcare providers, we must appreciate how these advancements translate into better patient outcomes. Now, transitioning to our next segment, we'll explore how the Soria Advantage leverages this revolutionary tip technology to ensure best-in-class performance. Transitioning from the last slide, we emphasize the significance of the catheter tip's tapering and forming, which is foundational for achieving a smooth venipuncture. With the Soria Advantage, we take this a step further with best-in-class revolutionary tip technology. This technology results in a needle design that ensures smooth venipuncture with tightly controlled trim distances and consistent needle quality, ultimately enhancing patient comfort. Additionally, our design requires minimal incremental force for catheter insertion, demonstrating ease of penetration. This not only lowers the pain associated with insertion, but also assures healthcare providers of the safety of the MedSource International Safety Catheter products. As we progress to the next slide, we will explore IV catheter terminology to further enrich our understanding. Let's take a look at IV catheter terminologies. A catheter is a thin tube that is inserted into the body to remove or inject a liquid or to keep a passage open. A cannula is a small tube for insertion into the body or vessel. Diameter refers to the distance through the center of something from one side to the other. A catheter hub relates to the component which holds the needle. A gauge chamber is a barrel that encapsulates or seals the needle when it is in the locked position. Finally, a needle cover is the plastic covering that protects the needle before the device is used. In the next slide, we will continue with IV catheter terminology. A bevel is a cut and polish of the introducer needle. The bevel heel distance refers to the distance between the heel of the bevel to the leading edge of the catheter cannula. This is measured in the hold position. Flashback refers to blood traveling through the introducer needle into the blood flash chamber. The term venipuncture refers to the puncture of a vein as part of a medical procedure, typically to withdraw a blood sample or for an IV injection. In our next slide, we will finalize IV catheter terminology. The pull force refers to the force required to remove the needle cover. The unlock force is the force required to overcome the safety mechanism. The friction force is force between the cannula and needle, and the cannula and the patient. The penetration force is the force required to gain access to the vein. A needle stick is the penetration of skin by a needle which was in contact with blood, tissue, or other body fluid before the exposure. The burst pressure is the point at which the cannula will fail as a result of pressure. In the next slide, we will demonstrate how to use the Soria IV catheter.
Okay, this is the Soria 18 gauge cannula. As you can see, it has wings and it has a port on the top, and what we're going to do is we're just going to go through it. The most common ways to use and deploy the device to a patient. So if we open up our wings, if you notice I've turned the cap on the port, I've turned it to 45 degrees. That's just for me, I find it easier. For holding it, put your thumb over the blood stopper, because that's keeping the device and the safety engaged. And put your finger just in front of the port. That's one way of using it. The alternative, you can put your thumb in the thumb tab and you can cannulate like so. Or you can put your fingers in front of the wings and your thumb on the stopper. Whatever you're most comfortable doing. Remember that this device has a triple beveled edge on it. It's much sharper than what previously has been used. One of the things with the sharpness is we need to consider whenever we go in at our angle, okay, roughly around 25 to 40 degrees. It's not an exact science, but we pierce our vein. Once we've pierced the vein, then it's important that we lower down, flatten down a small bit, 15 to 20 degrees, and then advance up the vein. I'm going to demonstrate that now. So we just have a mannequin arm here. It's turned on, so we're going to cannulate the patient. Okay, as soon as I pierce the vein, we can see our flashback, our primary flashback up at the blood stopper is there. Okay, so we're going to advance in, and then we're going to slide off, and I can see the blood coming up, or the solution coming up the catheter, and then just sliding it into place. And I can see it here already coming up. I'm going to pause. I'm going to remove the safe sharp with one hand, and I'm going to put the cap back on again for all the solution leaks out. Fortunately, with older mannequins, they tend to leak. So the safety has been engaged. As you can see, the flashback is full. So it's very important, as I said, to make sure you get the angle right. Come in, lower down, and advance your catheter off. So what can happen, and has been discussed, is this, and that's extravasation. I may not say the second word right, but that's how it is. Where the catheter has come out through. That occurs when the catheter is put, the cannula is put in, and they come back at too high an angle and then advance, and that goes through. We'll see if we can get it to happen here just in a demo. Okay, so we're going to go direct. I'm using a grey this time, 16 gauge, and we just have a go and see if we can get this. So again, same position, thumb tab I don't particularly use. I'm going to go to the blood stopper cap and just go to the port. So let's see if we can simulate the extravasation happening. So we've gone in, high angle, moved forward. Voila! We actually didn't get it to happen, but we got a perfect cannulation. I know there has been some discussion over pressure being put on and how the catheter are kinking. We're going to just look at that 16 now in a second. I'm going to dispose of my sharp. I'm going to clean up that little bit of a spill from this mannequin, and we're going to just remove this, then we're going to inspect. So there's no signs of the needle going out through it, and the catheter appears to be straight. So we just lay it down. Okay, I'll actually dispose of it in the sharps canister. And that one. The device that you previously may have been using, okay, was this one, which is by BD, which was the Pro Safety. Because of the way the Pro Safety was delivered or was being cannulated to the patient, you could have held it off the hub of this, okay, or you could have held it off the wings, or you could have cannulated from here. And then obviously you remove this in order for the safety to come out. So it's slightly different from what you were using. This would be how I would use it, but we can use it with the thumb tab to see if that works any different. So we don't have a flash yet. That's turned off, which could be the reason. And then we have a flash. So we've come forward, we've flattened out the tabs, and we're now going to advance, and we're going to remove. And we can see that we have a flash and a leak all the way to the top. Sorry, I just need to get the cap off that.
Thank you for watching. Please contact us in Critical Healthcare if you have any questions or would like further information.